Hi, everybody, and welcome to Medicine Meets Microphones, Lessons in Listening from StoryCorps and Providence. We're in for a session of social uplift, I think, today. Thank you all for joining us. First, just some brief housekeeping. You're all going to be muted on here on MS Teams live. Please go ahead and put your questions in the chat, and we will address them probably at the end, maybe in real time. We'll see what happens. And please note that this is being recorded, and it's going to be posted on the Institute's website, and we'll have that available at the end of the presentation here. There's the agenda. You guys can soak that in. That's the ride that we're going to be on. And as for introductions, I'm Mike Drummond. I'm Chief Communications Officer at the Providence Institute for Human Caring. I'm also co-founder of the Hear Me Now storytelling and listening program and its sister podcast of the same name. With me is Emily Jansen, Director of Learning and Engagement at StoryCorps. She's joining us from the East Coast in New York. Welcome, Emily. It's so great to see you. And joining me here in the Renton studio is my dear friend and colleague, Michelle Manning Herman, and she's a Senior Program Manager for Providence Strategy, Leadership, and Governance Services. All righty, so I am going to turn this over to you, Emily, and you guys are in for a treat. Emily, the show's yours right now.
Thank you, Mike. Thank you so much for inviting me and StoryCorps into this conversation today. At StoryCorps, we're so invested in the questions that you've posed today in this storytelling as medicine session. You know, how can we listen deeply to one another? How can we hear each other as fully human? And as longtime collaborators and friends of the Institute for Human Caring and Providence, it is always great to be in such good company. I'm just going to get us started and talk a little bit about the story of StoryCorps and what we do in relation to this. So StoryCorps began in 2003 with a really simple idea: to document the voices and stories of people from all walks of life. You can see our mission here: to preserve and share humanity's stories in order to build connections between people and create a more just and compassionate world. We started this work by building a tiny recording booth in New York City, nestled in the corner of Grand Central Terminal, the hustling and bustling transit center. Our recording booth was a quiet place where people could come to have conversations about their lives and preserve their memories for future generations to hear. And that little idea stuck. So now, almost 2 decades later, we've moved beyond that booth in Grand Central Terminal and have brought StoryCorps into communities across the country, into libraries and bereavement centers, hospices, hospitals, and into people's homes. Since we began, more than 500,000 people have come together to record and share their conversations and archive them with us and at the American Folklife Center at the Library of Congress. We like to think of these as poems of who we are as people. So I want to share a few of those voices now. We're going to play for you a selection of voices from our archive. So let's hear that now.
I was 17.
I'm 59 years old.
I'm, I think 81.
That's right.
Is that right?
Yes.
Okay.
I've got your results back.
I had a mild heart attack.
Well, let me have it. What have I got?
You've been diagnosed with diabetes.
My life changed forever.
And how did you deal with that?
I talked to my mother about it. Guess what? My mother said, oh, my great auntie had that.
I think you just learn to deal with it in different ways. Sometimes alone and sometimes with an awesome sister.
I didn't know you when you went through your treatment or diagnosis. I met you afterward. That's the person I know, and that's the person I love.
It's made me more considerate of others. Just from the question, how are you feeling? What's going on with you?
I'm still learning about my diseases. And I'm so good with it right now. That's why I'm talking about it. I'm so good with it because I want to live.
Thank you for allowing me to travel this road with you.
I think I have a great gang of wonderful children.
And grandchildren.
Yeah.
And you know what? They're going to love listening to this interview when they grow up.
That's the biggest thing you can leave as a legacy.
We love you, Dad.
In these little snippets of conversation, you can hear some of the key ingredients to our model. Story is in our name, but at the heart of it, StoryCorps is about listening. The voices you just heard are pulled from 40-minute long conversations. At StoryCorps, we bring two people together to record conversations about what matters most, with a facilitator who holds the space and walks them through the process. That facilitator is a first listener, a witness, a recorder, an archivist. In this picture that we see here, of two people sitting across the table with microphones in front of them about to record a conversation. But what you don't see is that off to the side, there's a facilitator in the room. But what else are the key ingredients that make a StoryCorps conversation a StoryCorps conversation? What's the magic that we hear when we're listening? We've been doing this for almost 2 decades, and the heart of it has not changed. First, we're stepping out of our everyday lives with intention to ask one another the big questions that matter. What are you most proud of? How do you want to be remembered? And in our hectic and everyday lives, it can be very rare to take full 40 minutes to sit down with someone we care about and ask them the questions that really matter, even if we live with them. And certainly we know how hard this is in busy healthcare settings. StoryCorps is about creating those intentional spaces for conversation and connection. Second, as you've heard me say over and over, these are conversations between two people who are connected to one another. They aren't being interviewed by a professional journalist or a historian. There's an intimacy to that connection. They know what to ask and are invested in the answers. Third, these are participant-led conversations. They lead the process and choose the topics and questions, often from a list of suggestions we have to support them. And when they're done, they receive a copy of their recording to share with family and friends, and then they decide if they want to share that with us and archive it for others to hear. And that's the final component, the option to leave a legacy for future generations. We hear from folks who record that it is often the motivating factor, particularly for those experiencing illness or grief. They want others to learn from their experience and know that they are not alone. We like to think of each conversation as a pebble thrown into a pond and the ripple it creates. The experience of the interview itself is powerful. When you take that moment of your day to really listen to someone else, you're telling them that they matter. But the impact does not end there. It grows with every listener through family and friends, by sharing it in the broader community, by adding it to the archive for future generations to hear. And we know this is true because of what we witness in our recording booth, but also because what we've heard from people over the years. We survey our listeners and people who record with us, and they say they feel a deeper sense of understanding of and connection to their partner after they record their story. And listeners say that listening to StoryCorps helps them better understand the experiences of people who are different from themselves and help build awareness and appreciation of society. A fun fact, in our 2021 survey, 76% of listeners who responded said that StoryCorps increased their understanding of issues faced by people with disabilities and serious illness. So many of the voices we heard a moment ago were recorded as part of StoryCorps' Legacy program. So for over a decade, StoryCorps Legacy has provided people of all ages with serious illness and their families and caregivers the opportunity to record, preserve, and share their stories by partnering with organizations across the country, like the Institute for Human Caring, including hospitals and clinics and pediatric centers, hospice and palliative care departments, and disease-specific organizations. Through our Legacy program, StoryCorps provides professional recording equipment and in-depth training to prepare our partners to record StoryCorps interviews, to be the facilitators that I mentioned earlier, and we help them incorporate the StoryCorps experience into their existing services. We do this for the goals that we know that you all share here, to meet the need for conversations during transitional times in people's lives, to reduce feelings of isolation by connecting people who may be going through similar experiences, and by sharing stories to contribute in some way to the larger national dialogue around the experiences of people with serious illness and their caregivers. So we're going to listen to one of those stories now. This story comes from the Grady Health Ponce de Leon Center in Atlanta, Georgia, and we're going to hear Peter Bird. He grew up in a big family, and he knew from an early age that he was attracted to men. He came to record a StoryCorps conversation at Grady Health with his friend Lisa Rowland to talk about his childhood and finding hope and connection after his diagnosis with HIV. Let's listen to his story now.
My father was a football coach, not only undefeated at Morgan, but they were not scored upon for 4 years. And he was very big and very bold and very smart. Wow. And very masculine, but he never, if he would drive home and I'm on the porch combing Barbie dolls hair, he never said a word. Wow. He never skipped a beat.
Talk a little bit about when you knew you were gay and kind of how you came out and what that process was like for you.
When we were 4, 5, 6 years old, my father would put us on top of the lockers to get us out the way. And I was aware of all of these guys, all these jocks, naked and snapping towels. And it hit me just like somebody grabbed my throat and I just started crying. That was when I became aware. If you're like that, people can beat you up. If you're like that, the teachers won't protect you. If you're like that, the ministers don't like you. It was just the beginning of trying not to be something that got your behind kicked all the time.
When they told you you were HIV positive, what was your first thoughts or feelings?
I didn't really care. I thought it was inevitable. All of the hopelessness that I had been garnering since I was a little double Dutch jumping boy it's over, you know, and it's just, now it's over. 3 months after I was diagnosed, I went to a reader in DC and she told me, stop worrying. This is not the end. This is the beginning for you. This was 3 months after I was diagnosed. She said, this is going to save your life. And I was looking at her like, you are so wrong. If I knew where you put the money I gave you, I would take my money back because you've never been wronger than you are now, because I'm not telling anyone this horrible secret. She told me not to worry about where I was living and you're not going to be sick. And she said, this is going to be your life.
And here we are.
And it is. I used to have wait lists for fools in my life because then I could be a fool too. But the team of people in my life are the most supportive, the most learned, the warmest, most loving friends. A lot of people don't get a chance. I've had a million chances. And so I really want to honor all that has been given to me by how I treat people, how I embrace the world, how I keep myself safe, how I feel loved, how I give love.
That story, Peter Bird's conversation, is just one of almost 2,500 stories that we have archived at StoryCorps in 26 different languages with participants of all different backgrounds, ages 4 to 106 as part of our legacy program. So over the past 10 years, we have established these programs in collaboration with over 55 partner organizations across the country, trained more than 500 people as these StoryCorps facilitators in their community. And that includes partnership with Providence and the Institute for Human Caring. In the early years, just starting the Hear Me Now program. So I'm really excited to pass it back to Mike and hear more about everything that's been happening in that program over the years.
As I'm reflecting on Peter Bird's story, he said, if you're like that, the ministers, your teachers, I guess even your friends can turn on you. It's interesting that the people in your trust orbit, your trust universe, can become not that. And that's really powerful. Thank you for sharing that with all of us. Well, we founded Hear Me Now in 2016. Initially in partnership with StoryCorps, and we've adapted it for our own unique needs, for our own healthcare model needs. And our mission is to make healthcare more humane. We do so by inviting caregivers, providers, patients, their loved ones, and communities to record and share their stories. And we're all about offering a platform for people to be heard and understood. And as a friend of mine reminded me that Providence Mount St. Vincent, the third part of that is to be known. So to be heard, understood, and known. We'd like to play a clip from our collection. It's called Rooted in Love. It's about a hospice nurse and a family member and their long-term relationship. So let's tee that up and let's play it.
When we first met you, we came into St. Vincent's. My mom was given 2 weeks to live, and you were our first nurse. You came in, and I was like, oh no, this is not going to work. She is way too stern. And here we were trying to beg my mom to fight. You've got to get through this. You've got to be strong. And there you were looking right at her and just telling her, you are in control of this. And if you want to stop at any time, if the pain gets too great, you have the right to stop that. And you had me, ever since.
The whole thing about the nurse-patient relationship is to build a trust so that they feel comfortable. And my thought was always to go in the room and have a smile on my face and get to know them. And then they trust me, and then I could say anything to them. They knew when I came in that whatever was going on, I was going to take care of it. When people are facing death, they come to grips with what's really important in life. So you go down to the basics: faith, love, and family.
Do you have any memories that you can share about my mom?
I think the reason why we made a connection was because we were both single mothers, and she was from New York. And right away, when you talked to her, she had that New York accent, and she had the New York salt and vinegar. I think it's more like spice and vinegar. Yeah. And we talked a lot about New York, and she just was such a sweet person, very loving person. It was hard not to like her.
The first 2 months, I pretty much slept there and ate my meals there. And you guys fed me, you brought me blankets. I mean, you cared for me just the same as you cared for her. After my mom passed away, I brought this little plant.
That was the way we reconnected, because we lost contact. Yeah. You brought me the plant.
Because you had taken such good care of Elsie, my mom. I thought, you can care for the plant. And I left, and that was that.
And I've been taking care of it all these years. And every time I took care of that plant, I thought of you.
Wow.
I said a prayer. Over the 20 years, I gave cuttings of that plant to so many people.
2 years ago, I decided to become a hospice volunteer and came to St. Vincent's to get my name badge.
You get off the elevator.
Yeah. Jody? I'm like, Kitty. So we hugged, and there was the plant. To my surprise, you had 2 clippings for me. Now I've got those growing as well.
That plant, it just keeps on giving.
I know.
That's one of my favorites. There's so much to like about that one. I want to engage with you a little bit, Michelle, on that clip. Is there anything that you can relate to, or what is your kind of response to that when you hear a clip like that?
Oh my gosh, it reminds me of my own experiences with hospice, with my late brother, as well as my stepmother. Mm-hmm. And just the warmth and kindness of the individuals who were providing care for, our loved one as well as us. This story, it demonstrates the connectedness and the fact that, we have these individuals coming back together after so many years, still having that connection with that plant, mm-hmm. And knowing that the little seed of love that was given, at the moment of, her mother's passing, has gone on to benefit so many other people, to be shared with so many other people. And, I can picture that plant growing all over the place, cared for by all of the individuals that were touched by Jody. Yeah. So, yeah, it's a beautiful story.
It is. The thing I love about that, there's so much stuff to love about. The thing I love about it too is, not only the animation, but mm-hmm. the fact that you have the subtitles on it, and so even yes. The deaf community mm-hmm. has entree to that. Mm-hmm. And it's actually to your point, it's more than just a metaphor for continuum of care. It was mm-hmm. a metaphor for a loving relationships. Yeah. So that was a good one. Yeah. All right. So a little bit more about the Hear Me Now program. Like the StoryCorps program, we use traveling storytelling kits, 40-minute sessions, typically between 2 people who know each other, kind of carving out a sacred space to have this conversation, much like Emily talked about. But since the pandemic, we also incorporated a digital studio so we could record stories remotely and safely. So Hear Me Now and volunteer facilitators have collected more than 500 recordings from Anchorage to Anaheim. And this is, we believe it's the largest such medical narrative collection of any healthcare system in the nation. And I'm willing to get any pushback on that. So, although, it obviously pales in comparison to the size of the StoryCorps library. So many of our edited clips live on our brand new Hear Me Now or updated Hear Me Now website. And these clips are used for community outreach, philanthropy, relief of employee fatigue and burnout, media pitches, reflections, remembrance, recruitment and retention. And there was another one that I added, and it's not on our deck here, is development, personal and professional development. We are exploring ways to have training facilitators be a part of their professional development goal. Oh, outstanding. So, and then with participant permission, all recordings are archived in the American Folklife Center at the Library of Congress. And while StoryCorps calls them poems for posterity, we call them love letters to posterity. Mm-hmm. And all participants get a digital copy of their recording. Mm-hmm. So currently Hear Me Now is operational in 10 areas across 7 Western states that Providence serves. Anchorage, several sites in California, Missoula, Montana, a couple sites here in the Seattle area. And in 2020, just prior to the pandemic, Portland became our latest Hear Me Now site. And we're always looking for more. So if anybody is out there interested in having a Hear Me Now site, look us up. Before we get into more of this presentation, there's just one more note. Many clinical studies attest to the benefits of storytelling and listening for patients and providers. And these are just a few. I mean, there are tons out there, but these are just a few we collected. Storytelling has helped increase immunization efforts. This came from South Dakota State Medical Association study. Very important when we had very important to think about as we have still resistance to vaccines. Storytelling enlightened medical students on empathy for dementia patients, and that came from Penn State. And storytelling and listening have given cancer patients something very precious, and that is hope. And this comes by way of the journal Cancer Nursing. Okay, let's play another clip. We're gonna play Never Give Up. It's from our Hear Me Now collection, and this is highlighting a patient and professional experience. And I think it's from Providence, Mount St. Vincent. So let's roll that.
Hello, this is Christine. I'm a deaf woman. I have cancer. When I told my family members about this opportunity to do Hear Me Now, most people are like, wait a minute, they've never heard about a perspective of a deaf person with cancer and going through the medical field. So.
Sorry, folks. While we love that clip, and that's our 500th recording, that was with a deaf friend of ours. That wasn't the one we intended to play. So let's hit reset and play us Never Give Up, please.
I'm at the Tukwila office for Providence St. Joseph Health, and I'm here talking with my father, Colonel James A. Manning.
Good morning.
Good morning. Tell me about your arrival to Washington.
I arrived in Washington State on March 31st, 1957, to report into Fort Lewis on the first day of April. I was awe-inspired at the beauty of the land. I was just amazed at the comfort that I felt in being in Washington State. I unpacked my things and got ready to report into my unit. My buddy Elmo Douglas, he did not have an auto, and I had my little Porsche.
Your little Porsche.
And so we took off one morning and drove out to Mount Rainier, and we got out of the car. He and I were throwing snowballs, wearing short pants and a t-shirt, something unheard of in New Jersey.
Yeah.
I decided that maybe I should go ahead and tender my letter of resignation, ask to be discharged so that I could regroup in Seattle. I was recommissioned in the Army Reserves. Given my discharge, I had been advised, go to Boeing and apply there. And so I got a job with Boeing.
Nice. I know you met Mom soon after.
True. I met your mother, beautiful lady. One thing led to another, and it wasn't long thereafter that we did make a marriage.
Yeah. I know that along the way, things change. You and Mom wound up separating and getting a divorce.
Yeah.
We had some rocky times.
Yes, we did. Yeah.
You know, over the years, things were getting better after I married. You walked me down the aisle January 98. April 4th, 98, I got a call from my cousin, Linda, informing me that my mother had died. It was completely unexpected. I was overwhelmed and I was shattered. I didn't really comprehend everything that needed to be done. I will never forget the moment when you walked in the door. I felt like I had an anchor. You were so incredibly helpful, guiding me through all that needed to be done that day and from that day forward. We didn't have anything written down. It's one of those things that you don't think of until you wind up having that happen to you. But I know that you have done what needs to be done. Just before you had your fall, I
Yes,
think.
that's true.
In 2018, you had put together a living will as well as advanced directives. It lays out what you want to have done should you become incapacitated.
It's a necessary thing to have that type of documentation. The death of a loved one is a very shocking experience, as you well know. I can't speak highly enough of what one needs to do, his or her family, so that they don't have a second shock of what to do.
It gave me peace of mind. It gave me great comfort to know that if something happened, we would know exactly what to do.
We threw you a little curveball. Things happen. At the outset of this presentation, I said, what could possibly go wrong? Well, Michelle, we fully intended to play that clip, but not at this moment, but that's okay. All right, let's be present in this moment and talk a little bit about your experience with your dad now. He's 90, right?
Yes.
From Jersey?
East Orange, New Jersey.
There you are.
Yes.
Right. Tell me a little bit about what you guys felt about coming into that experience. Talk to me about the recording experience.
Well, my dad has always been one to be able to tell a story. And so, when we were talking about the opportunity to do a Hear Me Now recording, he was all for it. And so there were so many things that we could talk about. But I know that, I wanted to think very specifically about the moment that he arrived after my mother passed away, and how important it was for him to be there and to help me through that moment, because I had no idea what to do. And it was a kind of a clarion call to look at how we could avoid that happening again. His health was better than it is now, but we knew that eventually we would get to a point where we would need to know what he wanted, and so being able to put together an advance directive, I thought that was an incredibly important message to share, and to share why it's important. And so, while I knew we had 40 minutes, Dad could go on for ages because he has so many stories to tell. And so, being able to sit down with him and share that experience, which went by in an instant. And it was so comfortable and, as Emily was saying, an intimate experience, that it's one I know I'm going to cherish forever. And seeing the edited piece today with the pictures that were included really helped to elevate that story even more. And so it's something that I know both he and I will cherish, and our family will cherish forever. I wish I'd had an opportunity to do this with my mom, because that would have been wonderful.
That reminds me, I gotta get my mom to sit down.
Yes, you do.
She has shingles right now, and she's in her 80s, and so let's keep her in good thoughts.
I will.
Yeah. Well, one of the health equity campaigns, or one of the health equity initiatives that we're involved with right now, is trying to see if we can leverage and use storytelling as a way to encourage BIPOC communities, particularly folks in the Black community, to think about advanced care planning and fill out advanced directives.
Yes.
Because as we know, the historical record and all the mistrust in the particularly in the Black community with American healthcare,
yes,
needs addressing and redressing. But we're hoping that this sort of intimate experiences and these opportunities to be heard and understood and known can help bridge that mistrust.
Yes, I think that is probably the best way to re-engage with communities that may feel hesitant towards looking into their health, either from being afraid of what kind of diagnosis they're going to get, layered on top of that, the historical mistrust that they've had. It creates such an incredible anxiety. But being able to share these stories about advanced directives, about immunization and vaccination, and being able to hear those stories from people that look like me, is an incredibly important thing for us to do. So let's tell some stories.
Well, thank you for that. So I guess we have your permission then to share that story with the world.
Absolutely.
Good.
Absolutely.
Good. Well, the genie was out of the bottle because we just shared it with the world. But thank you guys for sitting down and having that great conversation. You noticed actually we've whacked it up into some other edits, other clips as well.
Excellent.
And have you guys received your the whole 40-minute
yes.
one? Okay.
Yes.
So, well, you have other treats then. We have some, I think we have at least another one, maybe two other ones from that recording for you.
Oh, excellent.
So, and hopefully you can listen to this one too without all of the distraction of the lights in the studio and stuff.
I look forward to it.
All right. Well, thank you for your insights and perspective on that. Let me see, back to our little presentation here. So up there on the screen, we have just a few testimonials that we have curated. And you guys could read, I'm not going to read those verbatim. You can read those. They've been up there for a little bit. So today, Hear Me Now enjoys widespread support across Providence. It has become a centerpiece of employee and patient engagement strategies at many service lines, including home and community care, human resources, mission, nursing, philanthropy, and population health. And speaking of population health, we wanted to share this story. It's part of one. It's a 7-minute clip, but we're only going to use the last 2.5 minutes of it. After the George Floyd murder and social unrest, we asked 2 Black employees to share their raw experiences with racism with us, right? And this was in 2020. And this session was our first Hear Me Now podcast, actually. And what's now a sister program to our Hear Me Now storytelling and listening program. And senior leadership has told me that podcast episode helped motivate Providence to launch a 5-year $50 million health equity campaign under the guidance of population health. So that was a tectonic moment for us. It was humbling and also, I think, imbued us with a lot of responsibility, and that's why we are using our storytelling program to try to capture more stories from BIPOC communities, to capture more advanced directives, to more proper and more earlier referrals to hospice, because that's kind of a nasty word in some communities too, right? And there's it's one of the most misunderstood areas of healthcare, I think.
Very much so.
You
hear the word palliative care or hospice, and immediately, you're thinking, well, okay, that's it, I'm done. When that is truly not the case. It is all about ensuring that you are going to be able to live the best life that you can,
Right.
As comfortably as you can, and as knowledgeably as you can.
Yeah.
And so, it is something that I know I have taken very close to my heart, to try and make sure that I encourage individuals to really think about that and not kind of shove that aside if and when the time comes to have that conversation.
Right. Well, so I referenced this 7-minute clip that we're only going to play the 2.5 minutes from. It's from a patient in Southern California, Providence, Carnell Hampton. He's in his 30s, father of 2. He had COVID and massive complications, was hospitalized for 295 days.
Oh,
it's like 10 months, right?
Yeah.
Gestation period. And during that, he was intubated. He was in a hyperbaric chamber. He had, all the medical cocktails necessary to help his recovery. Had some massive complications. Had his right leg amputated at the knee, and then all of his left toes.
Oh my gosh.
So you can only imagine how he feels about the healthcare system.
Yeah.
Or can you? Let's play that clip, David.
One other question I have is we've got a whole series of stories that we're doing separate from the regular Hear Me Now program that's all about Black and Indigenous people of color stories going through healthcare systems.
Okay.
Is there anything you would want to say about what it's like to go through this whole process as a Black man?
As being a Black man, it was one of the best experiences. Even though I've never been hospitalized, just the different cultures that you catch at St. Joseph's. You have your Filipinos, just the Asian community, you have the white, you have the Hispanic community. You rarely have a Black community at that hospital. Me as being a Black man, able to connect with all these people was so amazing. It was like breathtaking. I connected with everybody, man.
Yeah.
Now, I'm that type of spirit too. I'm not like, oh no, you're not my kind. Like, I don't want to talk to you. No, I'm a people's person. I've been like that since I was a little kid. That would be a good example of people coming together.
I'm real encouraged to hear that.
Getting kind of foggy at the throat talking about it, because I don't think the nurses and like staff members at St. Joseph's, I don't think they like see me as a Black man. They just see me as a human being.
See me as a human being.
What an incredible spirit.
Right.
After being in the hospital for, well over 200 days and having all of those things happen, it would break anyone. And for him to come through on the other side with the experience of this being a blessing is really, as he said, breathtaking. It's wonderful to hear that someone coming through our health system can reflect upon that as being one of the best experiences of their lives.
It's mind-blowing.
Yeah.
There are so many things to think about and I've heard this, I don't know, dozens of times now. But one of the things that gets me is that this wasn't a setup. We didn't know what he was going to say. I like to say that authenticity is the currency that Hear Me Now uses to showcase and purchase its excellence, because it's not a marketing thing, although it can be used for marketing, but it's not intentionally set up to be a marketing vehicle or anything that's kind of fluffy or cheerleadery. So when you get this authentic feedback from a patient who has endured as much as he has, that's a complete life changer for him. He's got to deal with like a new way to get around.
Yep.
And all the complications that come from being hospitalized that long, you know. It's just a powerful testimony to the loving and compassionate care that he received.
Yes.
I felt a lot of love that he got from there. You know, there was the photo of him with the clap out, I guess that's called.
Yes.
You know.
Yes.
I was surprised in a good way that we got that answer.
Yeah, that was, you know, that is really the gold of Hear Me Now, and being able to get that, you know, authentic response from this gentleman. It is so heartwarming, and it also shows that the individuals who are working here at Providence, you know, the mission, the values are deep, you know, they're bone deep in our caregivers, and that is reflected in the care that he received. It's inspiring, it's aspiring, and just lovely.
Well, yeah, thank you for those remarks. And, you know, candidly, we have some in our collection that, you know, tell some of a not so great side of their care. And, you know, but, you know, there's something we said for capturing the unvarnished and real experiences from people, right? Yes. So thank you for that.
You're welcome.
I don't know. Let's open it up for questions for anyone out there in the audience. Go ahead. You can add your questions to the chat, and I think we have someone in the studio who can help us facilitate and traffic manage some of that. Our phone lines are open.
Hi, Mike.
Hi, Scott.
We have a few questions. One, how long does it take to train people to record stories?
That's a good question. So the short answer is we can do it at under 3 hours. The longer answer is that we initially, when we were doing this with StoryCorps, and Emily and her team would fly out, and we would do this over a number of days. You know, it would be day-long sessions, some didactic, but a lot of it is hands-on. There's a lot of, particularly the in-person recording devices, take some mixture of science and art. I guess Emily could talk to that too. And there's also the care in which the care of the facilitator, the role of the facilitator has to be carefully managed, because this is a very those 40 minutes are very important. And a facilitator's role, while mostly passive, can play an important role in eliciting and asking leading questions, or open-ended questions rather, that open up the narrative even more. So we can do it in 4 days, or we can do it in 3. We can do it in person, or we can do it remotely. So.
Next question. What advice do you have for any organization who wants to start a storytelling program?
I'm going to want Emily to chime in on this, but I am going to say, what is your reason and who's your audience? And also, is it going to be for external audiences? Is it going to be out there on the web, or is it just going to be internal? I think you need to answer that question first before you go on down this road, because it does require some capital outlay. You do need, even with the remote system, you do need a laptop. Maybe not a dedicated laptop, but you need some sort of computer devices. And then if you're going to maybe partner with StoryCorps, you're going to definitely want to have to use their recording devices. Emily, can I can I throw you on the hot seat and see what advice you would give to any organization that wants to launch a storytelling program?
Yeah. Unmute. I'm trying to unmute. Oh.
You have unmuted, yes.
Great. Thank you. Thanks for your grace, everyone, on this. You'd think 3 years into this, I'd have it down. Mike, thank you. And I just want to expand on what you've said, which really are those key questions. I would ask yourselves, wherever you are, to think about all of the stakeholders that are involved, similar to what Mike said, but, you know, who do you want to invite into conversation? Who do you want to give that opportunity to record? Who do you want to hear those stories? Whether that's primarily the people recording them and their families, or because you want to share them in a more broad way. Who would you like to invite to be facilitators, and who has the capacity, the time for that, the skills for that? And who are the folks in your community who you could really lean on to be champions, to invite people to record, to spread the word, to help people, again, be invited into conversation. And then it's also understanding that taking that care to record, to prepare people to record, to listen, to archive, to share, that all takes time, and it takes some logistics and operations. So there's a question similar to what Mike said in terms of you have to put out resources, but that's also finding who has the time to really care for that program and steward it and coordinate it while you have it.
Excellent, Emily, thank you. It appears we may be coming up on time, but maybe we have time for like another question if one's available.
We have one more. How do you help people overcome their reticence to share their story? How do you help them see the value in sharing and putting their shyness or privacy issues aside?
Yeah, that's a really good question, you know, because even with the sacredness that in the way we approach our work, it can be intimidating to have a microphone in front of you. But I think this is a good role for the facilitator to bring down the temperature, the anxiety of the room. Also, I think another way to maybe lower the anxiety or reticence is to have the participants listen to some clips, you know, and kind of get familiar with what a recording actually kind of can and does sound like. Did you have any reticence or?
Well, like I say, my dad can tell a story for ages.
Sure.
You know, but I think, you know, at any time that you're sharing something personal, and especially when it's around one's health, you know, you can be thinking, well, okay, how far is this going to go? You know, do people really need to be all up in my business and that kind of thing? But, you know, I have to say that the opportunity to record his legacy kind of overrode any anxiety or concern that I may have had. And the fact that you're able to drive the topic in the interview, you know, it's not like you go in there and, you know, you say, okay, you need to talk about this.
Right.
You know, I was able to come up with the questions that I wanted to ask Dad. And he was able to answer as much as he wanted or keep whatever he wanted to keep private.
Right.
So it was really an incredible opportunity to share and to explore you know, what the possibilities are.
While you were talking, I'm reminded what a colleague told me. It's not our story. It's your story.
Yes.
You own it.
Yes.
And it's so when you're giving someone that kind of agency and ownership of their story, I think that can also help someone overcome a little bit of the jitters.
Yes.
You know. And by the way, that 40 minutes allows you enough time to kind of, you said it yourself. You kind of went like that.
Yeah.
You know, that 40 minutes, and StoryCorps was brilliant coming up with that 40-minute kind of marker. It's kind of a magic time where in the first 5 minutes, maybe it might be a little bit jittery, but it just goes away.
Yes.
And by the end of that 40 minutes, you're going, what happened?
Exactly.
Well, you know what happened here is we had a little magic. Thank you so much.
Oh.
And thank you so much, Emily, there on the East Coast. Hope you're staying cool out there. We wanted to thank you all for joining us. We do have some handout materials that are available. If you just contact us, there's our contact information right there. We'd be happy to share some materials with you, and we're always happy to engage in conversation. Thank you all for joining us. Be excellent to each other. Have a good one.